So Claudia, oh, actually I'm going to present Mental Health Europe first. So MHE is a umbrella organization of people who are interested in mental health from around Europe. We have about 73 members across 30 European countries. We've been active in the field of mental health for quite some time, working towards the European institutions. Our members include mental health professionals, national organizations, service providers, users and ex-users of services, family organizations, and also carers. We advocate for the rights of people with mental health problems or psychosocial disabilities. And I suppose an important thing to remember is that we're not funded by pharma at all. Our strategic priorities include promotion of a human rights-based recovery approach, parity of esteem, so that means valuing mental health equally with physical health. We promote community-based services, so we advocate for DI, or deinstitutionalization, and for better community-based care. And we also work on mental health in the workplace. We just wanted to let you know that we have an anti-stigma campaign at the moment called Each of Us. So the idea behind it is that each of us is part of the solution to stigma, and that all of us at any time could possibly experience mental distress. So if you want to know more about that, you can look up there. So I think I'll hand over to Claudia now to present the social pillar, and you can also remember that if you want to look at any of the background documents, they're in the dashboard.
Okay, thank you, Ava. So I will just give you a brief overview, just for those of you that have not yet come across the social pillar, or those of you that just want just a little reminder. So the European Pillar of Social Rights was first introduced by the European Commission's President Jean-Claude Juncker in September 2015 in his State of the Union speech. It is foreseen as a self-standing reference framework document of legal nature, and it should take into account the changing realities of the working world, and it should serve as a compass for renewed and strengthened convergence within the euro area. On the 8th of March 2016, the Commission brought forward their first outline of what would become the European Pillar of Social Rights, and the pillar should complement the European Social Acquis and guide social and employment policies, which are essential for the well-functioning and fair labor markets and welfare systems. Thanks. Then basically the pillar should serve as a reference framework to screen the performance of employment and social policies in the in member states and help drive reforms at national level. For the time being, the idea is that the initiative will be targeted at member states from the Eurozone countries, although other EU single market states could also adopt these measures. But at the moment, they are thinking about indeed implementing it only in the Eurozone. The Commission has launched a consultation process around this pillar, which will run until the end of this year, so until the 31st of December 2016. And here, public authorities, social partners, and civil society play a central role in specifically really trying to shape the pillar. And then the final version of the pillar should be presented in the spring of 2017. Let's say it will be the final version, but it will be the final draft or really final version. Well, we will see, we'll discover in 2017. Just to give a very quick idea of why this European Pillar of Social Rights is needed? Well, it is clear, especially after the crisis, that European governments have experienced and are experiencing still high pressures on public finance and on macroeconomic imbalances. And the work of the social pillar is just one of, is just part of the solution that is presented by the Commission to create a fairer and a deeper economic and monetary union. And what is very important is also tackling poverty and other social issues, because this is integrating the agenda for the economic development and growth. Just here, some data very quickly, which I think can make it clear why it is important to have a proper and a strong pillar and very properly implemented. Social inequalities have actually increased across European countries. If we look into it, in 2014, 1 person for citizens of the EU were at risk of poverty or social exclusion, which means 122 million people. There are also still quite significant differences between European member states. For example, more than a third of the population is at risk of poverty or social exclusion in Romania and in Bulgaria, in Greece, but much fewer are so in countries like Finland, Sweden, or the Czech Republic. It is also quite scary to see how almost every 5th young person under the age of 25 and almost 22 million men and women are actually employed in the European Union. And again, 26 million children in the European Union live in poverty and are at higher risk of poor health, including mental health, of not finishing school, and we know the importance of education for health and employment later on in life, inadequate peace support, and also of not being able to reach their full potential in life. So I think that if we look at what is the current situation, it becomes quite clear that something needs to be done at the European level, and we'll need to see whether the European Pillar of Social Rights will be shaped in a way that can actually have an impact. Now, very quickly, I will give you the preliminary outline of the social pillar, and then I will briefly show you what is happening with the consultation, what the Commission is trying to look into in the consultation. So the social pillar is structured around 3 main headings, each of which comprises different policy domains, and these policy domains are linked to different principles, which are a starting point, and they are linked to a number of rights already included in EU and other relevant law. Through our talk today, we will concentrate on some specific of these policy domains. Let's say that for each of the principles, the situation across Europe is varying widely, and there are also quite practical difficulties that need to be addressed. So I will just show you what are the 3 main headings and policy domains, and then we'll just touch upon some of them. So the first main heading is equal opportunities and access to the labor market. And these are the policy domains that are included. We have skill education, lifelong learning, we have flexible labor contracts, we have active support for employment, equal opportunity, gender equality, work-life balance among them. The second heading is fair working conditions, which includes the conditions of employment, the wages, health and safety at work, and the social dialogue and involvement of workers. And the third heading is adequate and sustainable social protection, which include integrated social benefits and services, other types of benefits like healthcare and sickness benefits, pensions, unemployment benefits, minimum income, disability benefits, long-term care, which is quite important, childcare, housing, and access to essential services. Now, as my last point is just to give you a brief overview of the consultation. So the This consultation that the Commission has launched, the one that will end at the end of this year, has three main aims. One is basically to make an assessment of the present European acquis. One is to reflect on how things are going, the new trends in work patterns and societies due to the impact of the demographic trends, new technology, even the crisis. And other important factors, and to gather views and feedback specifically on the outline of the pillar. So these are the questions that will be asked in the consultation. The questions pertaining to the social key are: what are the most pressing employment and social priorities? How can we account for different employment and social situations across Europe? And is the key up to date, or is there more that should be done at the European level? Concerning the future of work and welfare systems, well, the questions are: what are the trends? What are the trends that are most transformative? What are the main risks and what are the main opportunities? And are there policies, institutions, or practices which should be recommended as references? And finally, concerning specifically the European Pillar of Social Rights, the questions pertain: do we agree with the approach proposed? Do you agree with the scope, domains, and principles? And is there anything that is not well covered? What domains and principles would be the most important in order to strengthen and renew convergence within of the euro area and ideally of the European Union? And how should this be made operational? Do we see added value for minimum standards or benchmarks? And if so, which ones? I think this closes the general overview of the pillar. If something is not clear, or if you need to make a comment right now, you can either raise your hand, or you can just type the question. You can even, if you think about a question later on, you can just type the question, and we'll bring up. We will look into that, and then we can answer later on. And otherwise, I can then ask Alva to start with the first presentation on some of the aspects of the pillar and some of the specific policy domains and the link to mental health.
Okay, so I don't see that anybody has any questions for Claudia at present. So I will start. Yeah, so what I'm going to do is kind of present the potential of the social pillar for mental health and well-being. So how can the social pillar contribute to mental well-being? Well, one of the key focuses of the pillar is ensuring equality. So equality of opportunity, but also equal access to vital services, for example, mental health services. Ensuring access to better health services, including mental health services, ensuring that services are properly integrated. So one of the interesting things that the social pillar does is it actually introduces kind of principles that aren't necessarily included in the human rights framework. So there is actually one domain on integration of services. So as many of you will know, we obviously advocate for integration of employment services, health services, housing services for people with mental health problems. And yeah, another thing that another domain is that there's better health promotion and prevention in the workplace. So this is a key area of our work. And then ensuring that people with psychosocial disabilities are supported. So I have a few questions throughout my presentation just to kind of prompt you guys to think a little bit more, but you will be able to maybe ask questions after my presentation and also at the end. So my question here is, can you think of other ways that the social pillar can contribute to mental health and well-being, given what Claudia just told you? Because it is actually quite vast and deals with so many different areas that really can contribute, not in just the health respect, but we also know that people who are living kind of fuller lives, that contributes to mental health and well-being. So why is it important that we get the social pillar right? And we're going to be launching a discussion paper, so if you want to check that out. But a few of the points that we've made here are present in it. We really need to guard against downgrading human rights standards. We've seen that sometimes that's actually happened in other areas of rights, for example, in refugee law, where there's been these minimum standards adopted at European level that some people would argue have kind of, lessened those rights or downgraded them. So the social pillar reflects a lot of human rights norms that already exist. So from the UN system, for example, but also the European Revised Social Charter. And in particular, a focus of our work at MHE is on the United Nations Convention on the Rights of Persons with Disabilities. Now, this has a special status at European level because it's been ratified by the EU, the only UN convention to be ratified by an international intergovernmental organization like the European Union. So in fact, that's part of EU law, and we feel at Mental Health Europe from looking at it and looking at the annex which proposes a framework for the pillar, that it's not fully mainstreamed throughout. So we'll be saying that in our advocacy, but I'll also show you a few different areas where that's the case. Social issues need to be kept high on the EU agenda, and strategies need to be workable and implementable. So we've already seen from Europe 2020 and the European semester that they failed to deliver on the target on poverty and social exclusion. So what we want from the social pillar is that it really delivers on social issues and isn't just something that the EU kind of are using to say, oh, we're doing things on social issues. They need to be implementable. The other thing is, and I think we know from our, because we're an umbrella organization, we know that a lot of Europeans think that these kind of rights are important. And this is part of getting the message to people that the European Union cares. And that's another reason why it needs to be right, because it can't just be paying lip service to this. It needs to be actually having a real impact on the ground and changing things for the better. I'm going to focus in on a few different domains or rights, and one of them is health and safety at work. So why is there a domain on health and safety at work? Well, this is what the social pillar explains in the outline in the annex. There's a lot of new challenges for health and safety at work. There's less stable employment situations, new working patterns, and an aging workforce. And I know that a lot of you will probably know that that's very important to mental health. Ensuring protection against occupational injuries and ill health to all workers, addressing unclear legal situations, so kind of precariousness of work, social costs, improving firms' productivity, and then reintegrating people who've had health problems and rehabilitation. And this involves really training or retraining people, workplace adaptation, so we know adaptation, so we know that a lot of people who have mental health problems could really be helped to either stay in work or go back to work by having certain little changes, making their work a little bit more flexible, maybe bringing in a support animal if that's okay. And I think that some of the reason why we're talking about getting the social pillar right is because there's still a few things that are in the wording of the pillar that might raise eyebrows for people. So, for example, they say, however, enforcing preventative and corrective measures for SMEs can be burdensome. I don't think that's the right approach. Yes, we need to recognize that sometimes it can be costly, but everybody has the right to be safe and healthy in work. So another question for you guys is, what are the challenges from a mental health perspective in the workplace? And then I wanted to kind of zoom in on what exactly the wording is. So human rights is based on the language of obligation. And it's very important that we get that wording right in the social pillar. So let's have a closer look at what it actually says. So an adequate level of protection from all risks, which means including mental health risks or psychosocial risk factors that may arise at work, with due support for implementation, notably in micro and small enterprises, shall be ensured. Okay, so that's quite a robust language, and I also wanted to show what the basis of that was, or what the social pillar is currently saying the basis is. So Article 31 of the Charter of Fundamental Rights of the European Union on workers' rights to working conditions, Article 153 of the TFEU, which is one of the treaties, which allows the EU to adopt directives. That's a really robust basis at European level. So I also wanted to look at what is there already, because as Claudia said, part of this consultation that we want to be responding to is about what's missing at European level. What have they done? Could anything be done better? And I would say that there is definitely an argument that mental health hasn't been, and psychosocial risk factors haven't been considered in the same way that physical risk factors have. For example, there's a framework directive that applies to all risks, but I don't think it has really been used for mental health as much as it could be. So they released an interpretive guideline to say, you know, this framework directive actually applies to psychosocial risk factors. But yeah, there's still nothing where this is very overtly mentioned in legislation. So maybe that's an area that the social key could be strengthened. There's also framework agreements from the social partners on psychosocial risk factors as well. So just one question there: are psychosocial risk factors adequately addressed by EU policies? And what do we think is missing? Could there be a new framework directive? Should there be a directive just on psychosocial risk factors? I've heard from a lot of people who work on this that maybe that wouldn't be the best way, because it's hard to define what they are, and also a lot of people say that we should be focusing on promotion of mental health rather than protection. But what do you guys think? So I'm going to move on to the next domain, which I think is highly relevant to people with more pronounced psychosocial disabilities. So this is domain 16 on disability, and I wanted to just kind of go into why they wanted a domain on disability benefits. People with disabilities are at much higher risk of poverty and social exclusion. That's a figure from the Eurostats. 30% of persons with disabilities are at risk of poverty or social exclusion versus 22%. They face a lack of adequate accessibility in the workplace, discrimination and tax benefit disincentives, caution about design of disability benefits. They kind of have raised a little bit of a flag about how to design disability benefits so that people don't fall into this kind of trap of not looking because they know that immediately all their benefits will be taken away from them, and if things then don't work out in the work that they're doing, then they could be ending up with a very, very long period of trying to get back on benefits if they need it. Impact of availability of support services on employment and community living. So we know that we need support services for people with psychosocial disabilities to get equal access to the labour market, but also to live independently and be included in the community. So again, what is the wording of the domain and what is the basis for it? Let's have a look. Persons with disabilities shall be ensured enabling services, very important, and basic income security that allows them a decent standard of living. The conditions of benefit receipt shall not create barriers to employment. The basis that they have said is on Article 26 of the Charter of Fundamental Rights, Article 151 of the TFEU, and Article 153 of the TFEU. Now, what I think is missing is where is the reference to the UNCRPD within the annex itself. There are backup fiches, and I think there's one in the dashboard if you want to have a little look at that. But it mentions the UNCRPD, but yet this is part of EU law, and it's not actually mentioned in the annex itself, and arguably is the basis and now the most important kind of framework for people with disabilities. So why is there no reference to Article 28? And actually I've put, these are hyperlinked, so if you want to have a look at the article, you can press on them. And then another thing is that there's no link to Article 19, which is on independent living. And yeah, no link to employment either. And these are all articles that are fully articulated in the UN CRPD that the EU is actually bound by, and almost all the member states apart from Ireland at this stage. Is there anything we need to be cautious about, i.e. reference to designing benefits that leads to active participation? Another concern that we have is that this kind of argumentation was really used to exclude people from seeking benefits during the recession. We know that a lot of disability cuts happened and a lot of conditionality, and one of the first conditionalities is about people with psychosocial disabilities, because yeah, we need to understand how we can best ensure that everybody who has a disability is recognized by the state and gets the support that they need. Yeah. So that was my last question. What can the EU do to make sure persons with psychosocial disabilities are not overlooked? And yeah, how perhaps an idea would be that the EU could gather information about the different ways that all of the member states recognize disabilities. Yeah. So the next one is on domain 17, which is on long-term care. And I think this one is probably the one that some of our members might have the most to say about. So why a domain on long-term care? This is what the social pillar says. Because of population aging, changing family structures, and women's increased participation in the labour market, that there is now an increased demand for long-term care services. Family carers are filling the gap left by unavailable or costly institutional care services. And although a lot of people would prefer to stay at home, informal care is often the only option, which leads to a high financial burden. Ensuring access to adequate long-term care services and guaranteeing the financial sustainability of long-term care systems will mean increased effort for improving the provision and financing of long-term care. Now, there's very much a focus here on aging and older people and long-term care for older people, but what about long-term care in the community for people with psychosocial disabilities or disabilities in general? So I've asked the question there, how does this sit with what we know about the community care, in terms of mental health? Because we know that the aging population also can develop mental health problems. So yeah, how does this all sit together? And what is the wording of the domain, and what's the basis for it? So again, let's have a closer look. This is the actual wording. So that was what the reasoning for having this domain was, but this is the actual wording of it. The provision and financing of long-term care services shall be strengthened and improved in order to ensure access to adequate care in a financially sustainable way. Access to quality and affordable long-term care services, including home-based care provided by adequately qualified professionals, shall be ensured. And the basis for it is Article 34 of the Charter, which is actually really just on social security and benefits and social services, and not really on long-term care. This is the one that I think maybe we would have the most concern about, because there's absolutely no mention to Article 19 of the UN CRPD, which is on the right to live independently and be included in the community. You can click on that. I've hyperlinked it again, so you can actually see what it says. But basically, persons with disabilities have the right to live in the community, and this has been interpreted by the Committee on the Rights of Persons with Disabilities, but also by a European expert group, which MHE is a part of, on the transition from from institutional to community-based services, to mean that everybody has the right to live in the community. And we wonder how how this extends to older persons. Do older people have the right to live independently? There's a saying that the UNCRPD doesn't establish any new rights just for people with disabilities. It's that those rights already existed. So yeah, we have a lot of questions about this at MHE. How does this sit with Article 19 and the right to live independently? Is this long-term care domain just about older people? Can older people not have disabilities? What about older persons with psychosocial disabilities or mental health problems? Should they not have the right to community-based services in line with Article 19? What about the right to quality healthcare in line with Article 12 of the International Convention on Economic, Social and Cultural Rights? And also there's no reference to person-centered services or co-production in this domain, which is concerning to us because it seems to be very much weighted on, oh, possibly they can go into home-based services, but only if this is sustainable. So there's a very big question mark around this. I think about how it fits into the UNCRPD framework, which we know that the EU is actually bound by. So yeah, thanks for listening. I'm going to open up the questions now and see if any of you have asked any. But we will also, and if you want to ask, just put up your hand, and I'll give you the floor. I see that a few that you've asked questions, but if you want to ask, you can just do that and I'll unmute you. So Elise, I think you asked a question. Can I unmute you? Elise, are you there? Okay, so maybe you didn't have your. So can you give examples of some of the benefit traps? Okay. Yeah, I think there's a number of states, member states, that basically if you go into employment immediately, your benefits will be removed from you. Now, if that, I think everybody knows that there are times when it becomes very evident that things are not working out from the very outset, and also there are also contract clauses and things like that to give people probational periods. Now, it takes much longer to actually get back into the system if you immediately remove benefits from people, and they feel like they don't have that kind of safety of just taking a chance. So that would be, I know that they do that, for example, in Ireland. But maybe you guys can give us examples of what you think a benefit trap might be. Because yeah, I'm always interested to hear who's using these systems and who's properly supporting people back into employment, and how employment services connect and are integrated with social services. That's something that's very important to us at MHE. Does anybody have any other questions? Well, if no one else has any other questions, then I'm going to hand over to Christine. Oh, we had a hand? Oh, 1 sec. It's gone? No one? Okay. So I'm going to hand over to Christine, who's going to tell you about social determinants, is it?
Yes. Yes.
And if you want to use that, you can.
No, it's okay. Thank you. Maybe I should move here to be closer to the. So, yeah, thank you very much. I mean, thank you very much. Although that was very intense, I think for everybody, and it was very interesting for us also at EuroHealthNet to hear more about your perspective, and also the fact that you are looking at wording and legal issues, which I think it's important. If the pillar is going to be, depends what will be the legal framework for the pillar, and this is something that we don't know yet. So we are now trying to get to my presentation. Okay, no, okay. So from the perspective of EuroHealthNet, for us it's important to see, okay, why is the European Pillar of Social Rights relevant for tackling health inequalities? And Claudia has already briefly told something about this. because if you say European Pillar of Social Rights, then okay, you say, okay, but it's social, it's not health. But I've also highlighted how important it is if we think at a person and we try to integrate services. So either than having services in silos, working in silos, health on one side, social on the other side, and then what about the conditions where people live and they are born and grow and live, which are so important for health and well-being. And this is kind of the main framework that we are working with. It's kind of a nice picture made by Dahlgren and Whitehead in 1993 already. And it highlights how even if we are different from age, sex, and we have constitutional and biological factors which influence our health, there are the individual lifestyle factors, the social and community networks, and all the other macro policies in agriculture, education, the work environment, social protection. So the entire unemployment, water and sanitation, healthcare services, housing, all these living and working conditions are what influences our health and well-being. So it's not about one single group of risk factors that we have for our health, but we have all this broad spectrum. So the idea is that if we do something now and we have good provisions in the social pillar, that will be very good in terms of health and health inequalities. So if we go further on, for example, let's take one specific area, like early childhood development. And Claudia already briefly mentioned, if we look for this specific area at the social determinants of health, we have neighborhood deprivation, low parental income, educational attainment, if their parents have a high job strain, if the parents are unemployed, if there is a material deprivation in the household, then all this can create adverse child health and development. And then later on in life, you will have poor health, and you will have automatically the child in a low socioeconomic group. So it's so important. Only if you look at this area, you can see how important the social determinants are. So, and then we look at the pillar, and we say, okay, the pillar has one policy domain, which refers to children, and it's the one on child care. And it's actually policy domain 18, so out of 20. And then what the pillar says, it's the fact that actually when it refers to that, it's to ensure access to quality and affordable childcare services for all children, and measures should be taken at an early stage, and preventive approaches should be adopted to address child poverty, including attendance for children with disadvantaged backgrounds. So you can see this is an overarching kind of statement or principle, but it's so much less than we would kind of really need. So what can be done? It's actually looked at how children's rights could be mainstream in the whole pillar, and how we can increase investment to really support what is needed in the area. We need good quality of early years education and child care. We need pre- and post-natal provisions, which are not mentioned. Parenting programs are hugely, highly important for people from low socioeconomic groups, for people living in poverty or being socially excluded. Parental leave needs to be appropriate and supported by decent income. A work-life balance is very important, because more parents have time to take care of their children. That is hugely important for the child development. And then in the same time, you have to have measures that are both universal and targeted. It's what Marmot has called proportionate universalism. Because if we are having a measure which is kind of universal, we will not be able to reach those which are most in need. So how can you strengthen also the voice of children in the pillar and in what is happening at policy level, at EU level? So these are only some of the things that we would like to ask. And then if we go to another domain, for example, it's healthcare and sickness benefits. It's domain number 12 out of 20. So then in the pillar it says healthcare systems should encourage the cost-effective provision of care while strengthening health promotion and disease prevention. So when we talk about health promotion and disease prevention, although it has been recognized that it's a key an important issue to ensure financial sustainability of the healthcare system, because if you invent in health promotion and disease prevention, then you will have less costs in healthcare later on. So it's kind of try to ensure that people don't get sick. There is only this small mentioning about one of these kids, which has been, it's now crucial. So what is good in the pillar is that it is mentioned now that everyone should have timely access to the good quality preventive and curative healthcare, and the need for healthcare should not lead to poverty and or financial strain. But as Claudia mentioned some of the questions, okay, how can this be operational? This is again an overarching principle, it's an over-encompassing definition, but okay, what else we need to make sure it's there that will make possible for the pillar to really work for the people. So what can be done? We can say clearly that we need more investment in health promotion and disease prevention, which is currently only 3% of the public investment. It's also important to have more focus on primary and community care. As Alva also has said, this is crucial, not only for health and well-being, it's crucial for mental health. Also, community care, it's something that more investment needs to be done to also to lift the burden from the hospital care systems. It's also important to address capacity and human resources. I mean, due to the crisis, a lot of shifting, a lot of services have been closed, access have become more difficult to population. So these are things that actually have not been addressed, but in the last years have been more reduced. How we can work across sectors to address wider determinants of health. So as I said, as I was saying at the beginning, it's important to work with the social sector, but it's also important to work with the environment. It's also important to work with urban planning, for example, to have healthier cities with less traffic and more supportive for health and physical activity. We can have, so it's not only about the healthcare system, it's so much broader that things that we can do to improve people's health. And not the least thing is how we can integrate the Sustainable Development Agenda and the Sustainable Development Goals, where EU also have signed for, and if the social pillar is going to have benchmarks or targets or what we'll have, how this will be aligned with the other global commitments that EU has and also the EU member states have engaged to. So if we are going to look at another domain, integrated social benefits and services is the 19 policy domains. And it says that social protection benefits and services shall be integrated to the extent possible in order to strengthen the consistency and effectiveness of these measures and support social and market integration. So if we look at the pillar broadly, it's so much about work and employment, but it's so much less about social benefits and people that are not employed, and which are now actually the big problem. So what are the social benefits and services that we can afford or that we can do? Should we Europe, or should we limit ourselves to the extent possible, or should we try to make sure that we have a coverage and replacement rate that is appropriate? You know, if we look at, to consider exactly what can be done with the people for people with multiple disadvantages. The recent economic crisis, a Eurofound report, have shown that actually what we had as vulnerable groups before, in terms of ethnic groups or people that are old people or children, now we have also young families as vulnerable group, because the economic crisis have led them into unemployment, and they are young people with families which have fallen below the threshold, and they are not enabled to access these benefits. So how can we look and target better the way we are doing our social welfare policies? So can we have progressive taxation and other fiscal policies that are at EU level, or should we let this more to each country to deal with it as it is now in the pillar to the extent possible? So overall, we would like to see that the pillar has a principle of proportionate universalism across all topics. it's also important to see how we can have a better correlation between what we have now as an EU legislation and the European pillar. We should make sure that the pillar itself will not downgrade those policies in those member states where things are going well or are going better. As Claudia was saying a little bit at the beginning about the inequalities that exist in poverty between EU member states. So will this overall principles that are going to be established in the pillar, could they be linked with concrete policy developments in EU member states? Because concrete policy developments in new member states at national, regional, and local level, those are the ones that really can reach people. So what will be, from this perspective, the implementation mechanism? Will we have a timeline for the pillar? Will we have monitoring? Will we have reporting and accountability? How can we can make this really work? So in terms of last questions for discussion, there are several discussions that have been raised already in the discussions in the European Parliament and raised by other organizations. We would like to think, because we've discussed about children and families, so could we really have these security nets for children and families in which the loss of a job have led to loss of health and social insurance? So what can we do for those families? Do you have a monitoring of what is happening with the entitled measurements and actions for individual families? So how can we make sure that we reach people's needs and we don't have only a universal legislative frame in place that maybe doesn't work? Can we really improve the monitoring of services availability and accessibility? And we should look at healthcare, we should look at education and social services. Can we improve the way we are monitoring these things? And then also, how can we focus more on social protection and not mainly on jobs and economic growth? Could we invest more in health promotion and disease prevention? Could we invest more in children and families? And then Alva also, these are questions actually that Alva added on.
Yeah, so should the social pillar fully reflect existing human rights standards? And if so, in which domains do you think? The ones that I mentioned, for example, the UN CRPD, should that be mainstreamed throughout them, and how? Should the domain on long-term care be altered to reflect what we know about community mental health care being better in general than institutional mental health care? Is there anywhere we need to apply caution? I was talking about the conditionality, about making sure that you're not designing services which then exclude people from those services once they're, I don't know, in employment, etc. So how can we make them very enabling and yeah, good for everybody and good for their mental health and well-being. So I think Christine is finished. So this is the real time now for Q&A and also telling us what you think. So I think you could tell us generally what you think about the pillar, or you could answer some of the questions that we have already posed. I do want to say that we will send the presentations and also a questionnaire for evaluation later on, so please do respond to that. And yeah, also this is a plea to respond to the consultation yourself as well, because it's very difficult, I think as well, you would agree that from a EuroHealthNet perspective, we're not going to be able to fully reflect every single situation in every member state, and there are some questions that are very much focused on how can we make this operational in all states, knowing the different social policies, the different political contexts, the different histories in all of the member states. So if you guys want the richness of what's happening in your country reflected, please also respond yourselves. Yeah, so I'm going to see if anybody has any questions now. Yeah. So, sorry, I'm just looking through them. Shouldn't social pillar converge also with compass of mental health and well-being, the EU strategy of disability target on Europe 2020 and on social inclusion and poverty reduction? I think that's from our member Elise. Yes, I agree with you. That's what we want to do in our in our consultation response. We want to highlight the fact that, yeah, this should all be integrated with what's already going on. The disability strategy is mentioned in the fiche, but again, it needs to be reflected a little bit more in the actual pillar itself. And then also we need to see how all of these things are going to be integrated. So, for example, Europe 2020 still going on, European semester still going on, the disability strategy still going on. How will the social pillar kind of reinvest in those processes, and how will they be implemented through them? Do we have any other questions? No? Everybody's a bit shy today? No one wants to raise their hand? Or do you know how to raise your hand? Because I will unmute you if you have any. Are people paying attention? No? Oh, here's another. Ah, great. Also, I wanted to just say how many people, we had 12 participants from Bulgaria, Spain, Cyprus, Turkey, Finland, Poland, Belgium, Hungary, and a lot of you, I'm sure, have your own ideas on what the social pillar should do. So please do ask some questions.
Yeah, what is the future? We have one question there. What is the future of the social pillar in the light of Brexit and other discussions about the EU? Well, I think for the moment, Brexit, is not considered. I mean, the EU continues and the EC continues to do policy as usual and continue to discuss it. I mean, besides the council meetings, which one council meeting was formed only of 27 members, the things are continuing. Yes, and the presidencies have been changed. Otherwise, the policies and the policy development is continuing as usual. Regarding other discussions, indeed, this is what we would like to see for the pillar. As Alba was saying, we would like to see that the pillar itself is more integrated with the other existing EU policies, like EU 2020, like the EU semester, and we will see how this will work like. For the moment, we know that the Commission, so the consultation will end in December, at the end of December this year, and then I can tell you that the European Parliament will prepare the ample committee in the European Parliament will prepare a report about it, and then the Commission will organize a conference in January to discuss the feedback received and the way forward. So it depends very much on the responses that we are all going to send to this consultation, and to depend very much about the member states' position and the Parliament and so on and so forth. So we are hoping for the best, but we have to fight for it, kind of.
Yeah, maybe if I can add, it's Claudia from EuroHealthNet. If I can add one thing linked to the, well, not necessarily Brexit, but yeah, a little bit what is happening in Europe, is that I think that actually Juncker and anyway in general, they've realized that there is a problem, and this is one of their answers also more on the overarching European Union state, because they realize, I mean, many things were lost through the years, and including indeed convergence, and that's why I think that they want to use this to increase the cohesion in Europe, and that is also why it is important, exactly a little bit because of the atmosphere, how things are going in Europe, and upcoming elections as well at national level. I think we have 3 big ones. There's definitely France next year, and the Netherlands, and Austria. And I think that this indeed is also some sort of a way to try to make things right again. And this is also why it is very important that the social pillar is actually developed the right way and implemented afterwards the right way. I know that there were some discussions, like not everybody is happy, for example, about the fact that at the moment they're thinking about implementing it or making it, well, we'll see whether it is mandatory or not, but they're talking about the Eurozone. And so there have already been a lot of talk around, should it just be the Eurozone, and then the other member states, they can take part if they want or not.
Yeah, I think politically, austerity measures ended up being very, very unpopular and also blamed on the European Union because they were pushing it. And I think this is one way that they can show, oh, we're actually listening to people. We know that people, a lot of the cuts, if it was smart austerity, then maybe it would have been a little bit different. But the first things to go are things like, you know, disability allowances and older persons, or those are the first things to be, go. And that's because some of these people aren't as represented as others. And I think, the European Union has heard the message that it's not social enough, that its response to the crisis has led people into a situation of poverty, reduced people's access to services, all of this kind of stuff. And I think this is an attempt or an opportunity, at least, to try and steer the ship in a different direction, because it wasn't going in a very good one, I think. So we have another question here. Where did it go?
How to be sure? This one.
Yeah,
Up there. How to be sure?
So it's from Virginie Belfroy. How to be sure that social pillar will not be a minimum for all member states, and in doing so decrease the social legislation in some countries. Yeah, I think I already kind of went into that a little bit, that there is much higher existing standards, and we don't want it to be a race to the bottom in some areas. I would say that in general, I personally agree with a lot of the broad thrust of some of the domains, but there is quite a bit of conditionality in there, and I think some of that is to do with the fact that, as the European, in the social pillar communication, they note this, that different states are at different. Virginie, I see that you've put your hand up, so I'm going to unmute you. Hello?
Oui. Vas-y, tu peux parler.
Hello?
Do you hear us?
Can you? No?
We have no microphone, I think.
Ah.
Do you hear us? Can you hear us? I think we have no mic. Can you hear us? I think my laptop has no micro, no mic. Microphone.
Oh, you do have a microphone. You can speak now. We're just going to turn off our microphone because there's an echo.
Oui, mais j'en ai pas, moi.
So we could hear you there, Virginie, but we put you on mute again because, yeah. But if you want to type in what your answer is, we can respond to that. But yeah, what I was saying was that the EU have basically said that it's aware that different states are at different levels, and they don't want, I suppose, some of the standards to be unbelievably unattainable, because a lot of what they hear is, we don't have as much money as the Scandinavian countries. We can't operate that kind of a welfare state, and if we're going to make the social pillar operational for everybody, then there needs to be an understanding of the fact that they have not converged yet.
Yeah. I think maybe very briefly, there is this sentence that we use a lot when we talk about health inequalities, because it's the same thing that across states there are different different standards. There are some states in which they are quite advanced in tackling health inequalities compared to others, and it is better. And this, I think, should be a bit the basis for the social pillar, which is if your country is not in a very, let's say, at a very good level of tackling, well, in this case, health inequalities, or in terms of supporting people with mental health issues, or having a good policy for employment, and the welfare state is not as strong, well, then do something. If you're already doing something, well, then do more. if you're already one of those that are better at dealing with these things, well, do better. So it's do something, do more, do better. And I think that this should be the approach that should underlie the social pillar.
Yeah. We have another question from Alexandra. Hi, Alexandra. Thank you for this. My question is, how likely is it that at some point the pillar evolves as part of the hard law EU framework and the provisions is becoming binding, at least for the Eurozone member states? Do you want to?
Yeah, I mean, as far as we know, this is highly unlikely
For the time being.
for the time being, because it's, you know, I mean, as long as the member states are saying for the moment is that they want better Europe, but not more Europe. So that means that they want better coordination. Okay, they agree with that, but they prefer to leave the social acquis to be part of the subsidiarity principle, and then the treaties don't allow us to have hard law in this area so far. So unless a change in the treaty will be done, this is not really likely to happen. So it's quite not possible now within the EU legal framework.
Yeah, I suppose the way that they have thought about circumventing this, and the fact that they don't have competencies in all of these different areas, because yeah, they don't. They do have it, and I think like some of the areas we've talked about, they do, and they have the competency to make directives. Then in other places they have limited competency or shared competency where they can add on to the work of member states. So the way that they've envisaged this to work is that it will kind of act as a framework, but within that they want to make the social acquis more robust, depending on what their competency is. So I don't think that the whole social pillar itself will probably be on a hard law EU framework, because the competencies wouldn't allow them to do it on every single one of them. But yeah, they really want to work with the social acquis, the different areas where they could do directives, etc. And one of those examples could be making health and safety legislation more robust to really fully include psychosocial risks, for example. But I don't know if EuroHealthNet also have examples of those kind of areas where they could do more robust things.
Well, we work with our core work is on health, and we know that there it is not, but on some types of benefits, possibly.
Yeah.
On indeed giving. Now I am just brainstorming with myself in terms of whether you should have or not conditionalities. Yeah, which is indeed a quite controversial discussion.
Yeah, I mean, our approach to conditionality is that you also don't want to create a situation where people don't want to go to work.
Yeah.
So it is finding that balance, but also not just kind of assuming that people who've been out of the workforce for a really long time and then go into work will necessarily, yeah, won't need to go back on benefits. And if you have a very long process, then that really could allow people to fall into poverty. And then the people won't want to take that risk, and they'll stay out of work, and yeah, it's more expensive for the state then as well. So people, if you have questions, you can send them to all participants so everybody can read them, because a few people have requested that all the questions be sent to everybody. Does anybody have any more questions?
It's the compass of mental health.
We had that one already.
Okay. We take from Southwest, shouldn't the social.
Yeah, I think if no one else has any more questions, we can kind of just wrap up. And what I'm just going to just explain what Mental Health Europe are planning at the moment on the social pillar. So we're going to publish a discussion paper which just has some initial conclusions and has been approved by the board last week. It's quite short. We've included it in the handouts thing, but it's basically what I've already said about the UNCRPD, sort of conditionality, the fact that if this is something that the EU wants to promote, that it should be really doing it across the EU rather than just Eurozone countries. Human rights are not attached to currency. So yeah, if they're really serious about being more serious about social rights, that they should really try and get the rest of the member states on board. And we will then, after I release this discussion paper, I'll be sending all of you an email, well, our members an email, all of you an email about how we're going to take the consultation forward. So what I've done is I've drafted a response, and I'm going to leave you guys a month to kind of mull it over and think about it, and the rest of our members, of course, as well, and then send that to the Commission in mid to late December. So you can expect that email in your inbox very soon with the discussion paper, which will prompt people's thoughts, I hope, and then with the draft consultation response as well.
Yeah, also from the perspective of EuroHealthNet, we are kind of do a similar process in which we will publish next week a statement about what will be our main points as already discussed and consulted with members so far about the pillar main issues. Some of them I presented them today, and then we will have also circulate with our members our draft response to the specific questions that Claudia presented you at the beginning of the pillar, and we will allow time for feedback, and we will also hope to be able to upload our response in the European Commission system in December. So we will try to have also a more integrated approach, specific approach, and really be sure that all kind of questions that come from members and input that come from members, it's able to be reflected in our response. And we encourage also our members to respond themselves, because it's very important to have more voices kind of fighting for the same things, as we have common things also with Mental Health Europe, as you have seen today.
So yeah, I don't know if anybody has any more final questions, or Claudia, you want to say anything?
No, I think that, well, we've clarified there is not much time left, because it's, well, let's say 1 month, because then Christmas holidays will hit us. And so, yeah, just another, again, if you have, I guess, some very final, well, I'm talking about the members of EuroHealthNet, you're still in time, I guess, if you have any final comment or anything that you wanted to add to the response of EuroHealthNet as the network. But yeah, once again, I mean, remember, you have around 1 month, 1.5, in case to provide your like a national level, regional level answers to this. And it is very important. I mean, you know what the current situation is in Europe, so let's really try to make an effort here. I know it takes time and all. It's also a little bit difficult sometimes to grasp the concept, because it is linked to health, it is linked to mental health, but not necessarily directly. And we're talking a lot about the determinants also of health and mental health in this, but it is important. I think it is really important also for the future of the European Union.
Yes, I would agree with that. Okay, sorry, Regina has one question, or has she put up her hand? Okay, so Regina, what I'm going to do is I'm going to mute us, because otherwise we hear an echo, and I'm going to unmute you so that you can have a last word maybe before we finish, okay?
Yeah, so hello everybody, Regina from Poland. I would like to raise a very important issue, which from my perspective is at least between European level and country level. We observe a big gap between what is decided, what is discussed on the European level, and how national government listens to that, or how national government is obliged to follow what has been decided on the European level. So this is my question or issue, to incorporate into the action plan activity which is yeah, once more, how to bridge the gap between European level and national level. This is my issue.
Okay, thank you for that, Regina. Yeah, so I think this is an attempt to do that, really. But again, and I have to say this over and over again, taking into account the competencies that are in the treaties, they can't actually, they don't have competency in, for example, in some areas like, yeah, child development and things like that.
And healthcare also.
And healthcare, it's a very limited competency that they have. It's really about reinforcing and helping and sharing practices and that kind of stuff. So what I would say is that it is a real attempt by them to share the message that there are some things that should be universal, and that there are some things that help your economies. That's also the message behind the social pillar, that like ensuring that people don't go slip into poverty is good for economies, and that's the message that really underlines this.
I think what we are, in practical terms, what we are expecting is that if we have a EU level policy, then we can expect also financial mechanisms that are in place and that are supporting that policy, and that is also important for our members and for people at national level, because these financial instruments could be further used in line with this EU policy.
Yeah.
So
I think it will also be interesting, and I'm not sure here, you might know more, Christina, how the EU pillar of social rights will be linked to the European semester process. And I think we might find out this in 2017. And I am wondering whether there is a way in the consultation to actually mention these things, to actually raise this issue.
yes, it is, and it is in that part, in the last part, where they are asking how we can make it operational. I think this is the way to link it with the EU semester, and okay, the EU semester doesn't work very well. So in terms of implementation, many people are saying that. So okay, how we can be this a way? Could this be a way to strengthen also the EU semester process and have a stronger? I think also that for the moment the Commission themselves, they don't know how they're going to do that, and they are working for our response and suggestions on how we can see this being strengthened and as you're saying, implemented or supported, reflected at national level.
Yeah, and another thing that I had forgotten to say actually was mine was very much focused on the kind of human rights and the wording thing, and we could talk about this for a long time because there are 20 domains. But the other thing is indicators. I know that's something that EuroHealthNet are better than us at. But what if we're going to bridge the gap between what the EU says and what national governments want? What are the benchmarks? What are the indicators? And if you guys have any ideas about what the indicators should be, because this is quite a hotly debated thing at European level, even with among the health NGOs and the different health actors. What indicators could we use to say that there's a healthy health system and access? How are we measuring if people have access? All of these kind of things. So if you have indicators that you developed, or for example EuroHealthNet have ones that they think should be used.
There was a discussion, it was a handout, a briefing prepared by the European Parliament 1 month ago, in which they made this thing between inequalities, economic inequalities and health inequalities, and then they were suggesting that the EU semester should include an income inequality indicator in the indicator. So because for the moment it's true that in the EU semester they are looking only at indicators from the economic perspective, very much linked with the economic growth and what is happening there. Although the semester and the CSRs have made big steps becoming more social in terms of recommendations, this is not reflected indeed in the indicators part. So as Alva was saying, I think you should have your strong suggestions. The pillar give you the opportunity to really highlight which will be the best way to address this.
Yeah, I think the other thing is, should it just be economic indicators? What about quality of life indicators? Those would be good for the long-term care one, for example. Yeah. So yeah, if you guys have any indicators on mental health services that you think would be good, please do let us know about those as well when you're responding to the consultation, or my draft of the consultation, basically. And I also wanted to remind you that there are handouts here, so if you want to download those already, we will also share things around. So I don't think anybody has any more questions. So what we're going to do is close our discussion now. Thank you very much, everybody, for joining, for all the MHE, but also the EuroHealthNet members, and have a very nice day. Do you guys want to say bye?
Yes, thank you. Thank you very much. Bye. Thank you.